Hello, everyone, and thank you for joining our next session, the 2022 Rising Visionary Awards. My name is Jeff Todd, and I'll moderate this session. And I'd first like to introduce our awardees, Dr. Hursuong Vongsachang, an intern in the Ophthalmology Residency Program at Massachusetts Eye and Ear, and Marissa Shoji, an ophthalmology resident at Bascom Palmer Eye Institute. They were selected as co-recipients of the Prevent Blindness Rising Visionary Award, which recognizes an optometry, ophthalmology, primary health care, nursing, or other health profession student or resident in the United States who has the best overall application and essay in response to this year's question, what iconic individual, group, program, or research discovery will have a significant impact on the future of eye health in the U.S.? A copy of today's presentations are available on the iSummit website, and recordings will be available in the next week or so. I'd like to congratulate both recipients on this award. So presenting for us first is Dr. Vongsachang, whose award submission detailed the need and benefit for school-based vision care to be available widely and sustainably. She hopes that her current work in program implementation can one day translate into nationwide availability of school-based vision services through advocacy, stakeholder engagement, and continued research. The goal is to bridge gaps in vision care access for children in need. Welcome, Dr. Vongsachang.
Thank you very much for this introduction. Right, so let's get started with our session. Good afternoon, everyone, wherever you are. My name is Hursuong Vongsachang, as I've been so nicely introduced. I am very honored to be a co-recipient of the Rising Visionary Award. I'm very thankful for this honor. This award asked me to identify an iconic approach to vision, and I wrote about school-based vision programs. I hope to talk about the lessons learned from my involvement with these programs and how we can take them to the next level. So my experience with school-based vision programs comes from the Vision for Baltimore program in Baltimore, Maryland. This is a collaboration between the Baltimore City Health Department, the Baltimore City Public School System, Warby Parker, Vision to Learn, and Johns Hopkins to bring vision screening, eye exams, and glasses at no charge to students in Baltimore City directly in their schools. Here we can see one of the mobile vans where the screenings are delivered outside one of our elementary schools. So I think most people in the audience would agree that these programs are great for our children. These numbers provide a picture of what Vision for Baltimore has accomplished over the past couple of years. But beyond these numbers, these programs also aim to advance equity. How? So there's data to show that there are disparities in access to eye care and vision health. School-based vision programs often are primarily focused in under-resourced communities, and they try to bridge that gap by bringing care to children from more disadvantaged backgrounds. Down the line, we also aim to advance equity in other aspects of life. So in a study published in JAMA Ophthalmology in 2021, our team showed that students' academic performance improved following the receipt of glasses from the school-based vision program. So that all sounds good, right? So I'm not here to argue that these programs are worthwhile, since we have the evidence already to show that they do help. What we should think about now is how do we make these programs sustainable, effective, and widely available? How do we take this model and help long-term and widespread success? To that end, there are 4 components that we have learned along the way to help us towards that goal. So the first one is iteration. One of the keys to public health programming is continued monitoring and quality assurance. So I like this picture here in that it shows that there's often a gap between what we think will work and how it actually works in practice. So after these school-based vision programs are in place, it's not just one and done. We need to go back and make sure that they're effective. One way that we've decided to do this in this implementation monitoring is by doing focus groups. And this is the part that I've been heavily involved in. So we did focus groups with parents and teachers in our school-based vision program, and we did them directly at the school. And these parents and teachers, these stakeholders, gave valuable input on their experience with the school-based vision program, things that we could not have thought of. And they also provided fantastic suggestions for improvement. What I enjoyed about this type of work is the community engagement that was happening. Everyone was working together to find solutions for our own community. But beyond that, we can also share our findings, share what we've thought about together with other people, the larger community, people who are trying to do the same thing in making a school-based vision program in their own areas. So this sort of goes back to the research and practice cycle that I showed earlier. The next up, we also have to engage in advocacy. On the left, you can see a proposed bill for a Vision for Maryland program. And in it, they reference the Vision for Baltimore program. Engaging in government, no matter the level, is a key to obtaining support and resources for longevity and expansion. And in this case, they're thinking about doing this across Maryland. You can be involved in many ways. You can be a witness, provide a testimony, or help draft the bill. On the right, I've included a map from our team that shows the wide variation in vision screening requirements across the United States schools. What I've learned is that while we may primarily have a medical background or a public health background, becoming well-versed in policy and advocacy can help identify need and the ways one can make a difference systematically. Next up, we have education, and this is a very multifaceted aspect. At the first level, it means getting the community on board with these programs. This could be about the importance of eye care, demystifying misunderstandings about vision, or clarifying the difference between a vision screening and an eye exam. I took this picture at one of our back to school nights at a local school where we spread awareness about the importance of vision health and about our school-based vision program to families. So similarly, maybe not in such a fun poster, but we can also engage with policymakers, educate the vision community in avenues like this as well. There's so many ways to go out there and spread your message. And finally, we have application. So this is where we get creative. How do we think beyond the immediate model of school and vision and think bigger? One way that we've approached this is making schools a hub and one-stop shop for students' health via the Johns Hopkins Consortium for School-Based Health Solutions. We recognize that schools are where and how we can reach families. So in this consortium, we have many projects, one of which is the school-based vision program, but we also have asthma care delivered in schools in Baltimore. And then when the pandemic came along, we decided to deliver virtual COVID-19 education across schools nationwide. And I actually had the chance to volunteer with the Johns Hopkins Health Education and Training Corps, which is the group of health professionals that teach these COVID-19 classes to K-12 classrooms. It's such a fabulous opportunity to answer questions from families during a very scary time. And inspired from that experience, I also did some advocacy via an op-ed calling for public health education in our K-12 schools. And then in the idea of application and thinking big, thinking creatively, another challenge or interesting thought idea that I'm going to put out is, well, while schools can be a hub for children, is there a similar avenue for adults? How can we apply what we've learned from school-based vision programs to other populations that are in need of eye care? So I end with this quote from Dr. Sonia Santelises, the CEO for Baltimore City Public Schools. And she says, the fact about Vision for Baltimore, she says, the fact that this initiative has taken something so simple and organized adults in the way we do work to help us make sure that young people in Baltimore can see, to me is proof of what happens when a community comes together around the needs of its young people. So I love this quote because it shows how uplifting and inspiring and impactful these programs are. And it certainly has been impactful in my own career. And I'm honored to be speaking to this audience because I know everyone out here is doing so many wonderful things for vision health and public health in your own communities. So I urge all of us to think about these 4 areas: iteration, advocacy, education, and application, so that we can make all of our efforts and models in advancing eye care be even more successful. And of course, before I end, I want to thank the Prevent Blindness organization for this honor, but also I would love to thank the team at Vision for Baltimore, and especially my mentor, Dr. Megan Collins, for everything that they do to make this program possible, and also for changing my own career so much. And I've learned so much from everyone involved. So thank you very much.
Thank you, Dr. Vongsachang. It's been terrific listening to this. We've really followed the work of the Baltimore Public School program over the last several years, and have featured it a bit on our summit in the past. And so it's just terrific to continue to hear more about this great work. And now I'm going to turn to our second co-recipient of the award, Dr. Shoji's essay, A Guiding Light, A Vision for the Future, addressed racial and gender disparities in eye care. She outlined the need for a national program fostering diversity in ophthalmology, including recruitment of individuals at all stages of training, from interested high school students to fully licensed practitioners, with special emphasis on underrepresented minorities and women. Please welcome Dr. Shoji.
Good afternoon. My name is Marissa Shoji. Thank you so much for the introduction. I'm so honored to be here as one of the co-recipients of the Rising Visionary Award. Today, I'm going to talk about mentorship and diversity in ophthalmology and how increasing this will significantly impact eye care throughout the United States. So in thinking about diversity within the US, there are around 330 million people in the US according to the last US Census. Around 64% are white, around 19% are Hispanic, 14% are Black, 6% are Asian, and 3% identify as biracial. Around 50.8, around 51% also identify as female. Therefore, the US is pretty diverse. However, despite the diversity within the United States, there's considerably less diversity within the field of ophthalmology. Only around 30 to 35% of ophthalmologists are women, and around 6% are underrepresented minorities, including Black and Hispanic providers. As you can see here on the right, this has been slowly increasing over time, but not a significantly large increase over the past 10 years. Female ophthalmology residents have been demonstrated to have a lower volume of cases compared to their male counterparts, and there are fewer female ophthalmologists in leadership positions. Similarly, there are low numbers of underrepresented minorities in faculty positions, around 7%, which is low even compared to other specialties in medicine, as you can see here. So why does diversity within the field of ophthalmology matter? So there's a diversity of patients with eye diseases, often with different ethnicities and genders and disproportionate burden of disease. You can see that Black and Hispanic youth, as Hursuong mentioned earlier in her presentation, may have experienced blindness and visual impairment at a higher rate compared to white youth. Similarly, rates of glaucoma and diabetic retinopathy may affect African American and Black individuals at higher rates compared to white individuals. And these underrepresented minorities may be less likely to receive eye care. This may also be true for different ethnicities. Different types, Asian patients may be more likely to have certain types of glaucoma or uveitis. And gender disparities also exist, with women more frequently suffering from dry eye disease, glaucoma, cataracts, and thyroid eye disease. There are several additional reasons it's important to increase diversity within ophthalmology. First, it's important to establish a physician-patient relationship of trust and empathy. One study demonstrated that patients who are a similar race as their provider experienced a greater satisfaction with their care. This may be due to greater trust and connectedness. Similarly, other studies have shown that female patients may prefer female providers, potentially for similar reasons. Next, communication is also very important for both patient satisfaction and adherence to medication, as well as self-management of disease, which may be especially important in many chronic, potentially blinding conditions that require long-term care, including glaucoma and diabetic retinopathy, among others. Having that good communication with a good physician-patient relationship is especially important, and it also very key in patients who do not have English as their native language. So it's important to have providers who are able to speak different languages and have similar cultural backgrounds as their patients. And the third point I'd like to highlight is that increasing physician diversity may increase access to care. Studies have shown that underrepresented minority physicians may be more likely to practice in regions with more underrepresented minority patients, which may help address that these patients be at a higher risk for vision-threatening conditions, yet overall have less access to care. So how do we increase diversity within the ophthalmology and eye care community? First, it's important to have transparency about the current lack of diversity. A recent study demonstrated that only 29% of ophthalmology residency websites displayed at least one diversity or inclusion information criteria on their website. So it's important that we realize and recognize that this is an issue. Once there is more transparency, it's important to raise awareness of this problem and develop methods to improve it, including promoting and sustaining interest and engagement, as well as increasing representation of different ethnicities and genders at all levels, from residents to leadership positions. And mentorship may be one way to accomplish this. There are many goals of mentorship, including support, sharing experiences, serving as a role model, and providing different opportunities and exposure. Mentoring is also important to build long-term sustainable relationships. Some of the benefits of mentorship included increased mentee personal achievement and job satisfaction, which may be important to promote sustained engagement within the field and reduce physician burnout. Additionally, an interesting study found that resident mentoring of medical students led to increased self-confidence, exposure to the field, and likelihood to pursue the same type of residency as their mentors. Mentoring is therefore very important for helping promote and sustain interest in the field. Right now, there are only 2 national programs focusing on mentoring. In 2018, the Minority Ophthalmology Mentoring Program was established to increase mentorship to underrepresented minority college and medical students. And this year, the Women in Ophthalmology organization is developing a mentoring program among women attendings, fellows, and residents that will be implemented at the Summer Symposium this August. There's also smaller local programs, but there is still a need for mentoring. And these national programs are great initial steps, but it's important to be able to have long-term assessment and evaluate how to best support and optimize these mentorship relationships. One local program that we're instituting here at Bascom Palmer is a resident to medical mentorship program. And the goal is to increase access and exposure to ophthalmology. The goals are to demonstrate also all stages of training and provide a way to facilitate medical student connection with both residents and upper level faculty to reduce some of that stress. Around 32 medical students expressed interest and completed a survey. And here are some of the key findings. They agreed about the importance of mentorship and diversity, expressed only moderate identification with their current mentor, and also expressed hope for more exposure to the field as well as advice and support. So here are some of the baseline findings from the survey. The majority of the medical students were at least somewhat concerned about diversity. In thinking about diversity in terms of physician ethnicity, the majority neither agreed nor disagreed that the field was diverse. And the goal of this mentorship program and in general is to get more people into this agree and strongly agree category, that they agree and strongly agree that the field of ophthalmology is diverse in terms of ethnicity. Similarly, in terms of physician gender, the majority neither agreed nor disagreed about diversity. And again, the goal is to get more people to agree and strongly agree that the field is diverse, both in terms of ethnicity and gender. Some other interesting findings from the survey was that around 50% of the medical students have not yet had an ophthalmology mentor. Only 47% are satisfied by their current level of mentorship, and around 56% identify with their current mentor. So lots of room for improvement in mentoring medical students. When asking what medical students hope to get out of the mentorship program, they expressed some of the things that we talked about earlier, about opportunities, about advice, about exposure, about thinking about guidance and how we can both optimize their experience and exposure to within the field of ophthalmology. These are some of the keywords that were reported by the medical students here. While this local program is being instituted here at Bascom Palmer now, and thinking about the big picture, we'd also like to expand it to include high school and college students to allow for early exposure to the field. Ultimately, the big goal of the program would be to create this linked connection from faculty to junior faculty to residents and fellows to medical students to college and high school students to create these networks that are facilitated by existing connections. The goal is to create and combine both local and national programs. Locally, you're able to have more exposure directly to the field of ophthalmology, but also national is very important to be able to increase exposure and increase access beyond just the local level. It's important to be able to promote this type of program and promote interest in the program, and especially reach out to women and underrepresented minorities who might not who are not yet represented, as well represented within the field of ophthalmology. And then we also want to think about what works and what doesn't work. And so in thinking about the programs, it's also important to have a feedback system to evaluate and reevaluate to be able to better optimize the experience of the mentees to promote interest and sustained engagement within ophthalmology. So in conclusion, right now, there's currently limited gender and ethnic diversity within the field of ophthalmology, and mentorship may be one way to improve diversity through increasing exposure and access to eye professions, as well as encouraging sustained engagement. It's possible to start with local programs and expand and scale to a national level. And improving gender and ethnic representation within eye care will significantly affect eye care throughout the United States, especially for underserved and minority populations who may be able to better identify with their physician and better participate in healthcare and vision care. These are some of the references. And I'd like to say thank you to my amazing mentors at Harvard and Bascom Palmer, some of whom are pictured here on the right, and an extra thank you to the Prevent Blindness organization for the opportunity to speak today and for the Rising Visionary Award. And thank you all so much for your attention and for listening. I appreciate it.
Thank you so much for that terrific presentation and for both those presentations. We don't have much time, but I have one question for each of you that I'd like to ask. So, Dr. Vongsachang, how has your involvement in this specific work impacted your view of your career and your future?
Definitely. There's so many impacts that being involved with this work has done for me. One of them is exposed me to mentors who, like Marissa was talking about, you want to be like your mentors. And I've had mentors that are involved in academic ophthalmology, clinical ophthalmology, but then also all this public health programming. So that's what I hope my career will look like in the future. And these mentors are also the ones that have encouraged me to start that process, such as getting a public health degree to learn what kind of other interdisciplinary skills you need to have in order to make that happen. And I think definitely in residency, I'm hoping to gain that clinical knowledge, but then also figuring out what are the areas of need that I can start getting involved in now, and just merging the public health degree that I have and then the clinical acumen that I hope to acquire, and just putting that together to become like an effective public health ophthalmology person, like I've been exposed to.
Thank you. And, actually, Dr. Shoji, I'm going to ask you the same thing. How has your work in this diversity space impacted how you view the future of your career?
Thank you. I think there are a couple of things to think about, both mentorship and diversity. I think within mentorship, I've been really lucky to have some incredible mentors who have taken me under their wing for research, for clinicians, and have been true role models of what it's like to provide phenomenal care for patients and constantly push to advance the field. And so I feel very fortunate for that. And this mentorship program that they were instituting here at Bascom is one way to try to give back. I think in thinking about the diversity aspect, I think it's really important. I've seen a lot of patients in Miami in particular, where I'm based. There are many Hispanic patients. And so a lot of them express a more level of comfort and identification with Spanish-speaking providers. And I actually taught myself Spanish to be able to help try to facilitate that type of communication with them. And I've actually had several patients who come with their children and who come with their younger nieces and nephews, and they see, when they see women providers or they see providers of different ethnicities, they're like, wow, I can do it. Maybe I can be interested in being a physician as well. And actually, one of my most recent patients expressed something very similar to me a couple of days ago. She's like, I was interested in biology, I was interested in sciences, but I think I've had such a great experience here and seeing all my healthcare team that I really hope to pursue a career in ophthalmology as well. And so having those incredible mentors who paved the path for me, and hopefully me being a mentor as well, an example to other people, and thinking about on a national level, be other people serving as incredible role models of supporting their other physician and other medical student and even high school students' interest within the field of ophthalmology. I think that's an incredible way to expand the field of ophthalmology, to introduce new perspectives, and to really have a diverse field to take better care of patients.
Well, thank you both so much. As I mentioned prior to this session starting, once we engage folks here at Prevent Blindness, we tend not to let go. So I look forward to working with you and to continuing to follow your career as you advance. So we're now concluding this session. Please return to the auditorium and join the next session, which will begin at 2:20 Eastern Time. It's engaging technology to support vision health and quality of life. And in the meantime, don't forget, when you have time, please visit the booths in our exhibit hall, check out our on-demand library, or network with other attendees through chat or video. Thank you so much.